Welcome back. The actions of former Free State Premier Ace Magashule and former MEC Mosebenzi Zwane in the Vrede Dairy Farm project amounts to maladministration and improper conduct. That's the finding of Public Protector Busisiwe Mkhwebane. Today, Mkhwebane released her investigation reports for the third quarter. Govan Whittles following this story for us. He joins us live. So let's focus first on Ace Magashule and Mosebenzi Zwane. What's the remedial action there?
Yeah, so the Public Protector has made a range of different findings and recommended remedial action, which ranges from the Hawks looking at the report to see whether they should add any charges to that case against Ace Magashule or prefer charges against Mosebenzi Zwane related to the Vrede Dairy Farm project, but then goes a step further saying that the Free State Premier, the current one, and the Free State Provincial Executive should take note of the report and see which action should be taken, essentially saying they need to implement this report, which not only calls for further training of government officials on how to manage big flagship projects such as the Vrede Dairy Farm project, but also calls for government to put in place additional measures which would allow them to keep track and perform proper oversight of the project as it's being implemented. This to make sure that the beneficiaries aren't sold a dream, as Advocate Busisiwe Mkhwebane says. Let's have a look now at what she had to say about the Vrede Dairy Farm project and the former Free State Premier's conduct.
The allegation that there was political involvement in the Freida is substantiated, and then the allegation that the EXCO improperly appropriated funds to ensure payment of Estina even after Department of Agriculture has cancelled the contract is substantiated, and then the allegation that there was possible prejudice suffered by the intended beneficiaries is also substantiated. So, therefore, in the light of the above, the following are the remedial action. The Premier of the Free State, the current one, to take note of the report insofar as the findings and remedial action contained therein are concerned, and as the Executive Authority assist in ensuring that the remedial action as provided for hereunder is expedited. Within 30 days of the receipt of the report, ensure that the Speaker of the Provincial Legislature tables the report before the House for deliberations and consideration.
She's also made damning findings against Herman Mashaba.
This relates to his tenure as Johannesburg Mayor and a crucial appointment of the Johannesburg Metro Police Department Chief David Tembe. It's an appointment that Mayor Mashaba then defended vehemently and saying that everything was done according to due process, and he's also defended the work done by the JMPD under Superintendent Tembe. But the Public Protector now finding that that appointment was unlawful, also finding that the former mayor had influenced the city to take struggling youths or youth struggling with drug addiction to rehabilitation, also saying that was improper influence. But we have since heard from the former mayor, now head of Action SA, Herman Mashaba, who says that he will be reviewing this entire report related to his conduct as Joburg mayor in court. Of course, Busisiwe Mkhwebane, the advocate, saying that she thinks that the court case may become about technicalities instead of the merits, which is the unlawful appointment of David Tembe. But the former mayor is still insisting he did nothing wrong.
And then very quickly, her findings on PPE.
This is the most concerning because what we saw was a report tabled by the Deputy Public Protector, Koleka Galeka, which is a result of a fact-finding mission and visits to hospitals across the country during the COVID-19 pandemic. The Public Protector's teams have found inadequate staff numbers there and also inadequate procurement of PPE. Just a few of the things that were found is that medical waste was strewn in some of the corridors. In the Mthatha General, there wasn't even one vehicle because the sheriff of the court had repossessed all of the hospital's vehicles. She found that the procurement of PPE through the Department of Health at a provincial level was problematic because it didn't allow hospitals to buy it on their own, source it on their own. There weren't any designated drivers to go pick up the PPE. But more concerningly, the people who were washing the laundry of the coronavirus patients weren't given protection, and some nurses were told to use the same mask the whole day, and then that very same mask the next day. COVID patients were laying on beds without linen. Some had to bring their own linen. This is the state of South Africa's hospitals described by the Public Protector's team. She's asked the Department of Health for an urgent response to indicate whether this situation has changed. Of course, this investigation took place more than a month ago, but as things stand, it's not clear to the Public Protector whether South Africa's public hospitals are still in this state and whether anything has been done about it.